Oxygen saturation is the measurement of the amount of oxygen that is being carried in your blood. It's important that respiratory patients understand how their oxygen saturation rates relate to their feelings of breathlessness and overall respiratory health. Some patients have noticed that they feel short of breath even when their saturation levels are in the 90 percentile. Others noted that their saturation levels have dropped down into the 80s, but they don't feel short of breath. Saturation levels and breathlessness aren't always related. Oxygen is carried throughout your body to every cell and organ via a red protein in your blood called hemoglobin. Oxygen saturation is the measurement of how much oxygen saturates this protein. We measure oxygen saturation with a device called a pulse oximeter. A pulse ox is inexpensive, painless, and easy to use. It uses a red light that shines through your finger. The amount of oxygen in the blood changes the light absorption. By measuring this absorption, the oximeter can determine how much oxygen is in your blood. In order to get an accurate reading, take your reading in normal room light. If you're outside in bright sunshine, stray light can affect your reading. Ladies should refrain from painting their nails as that changes the color and saturation of the light. Most people with healthy lungs have oxygen saturation in the upper 90s. Anything above 90 is considered normal, but your doctor will let you know what your normal level is and at what level you should seek treatment. If you regularly have saturation levels of 88 or lower, your doctor will likely prescribe supplemental oxygen. Pulse oximetry is often used because it's easy for the patient to do and it's fairly accurate, but it's only one part of the picture of how well your respiratory system is functioning. Your respiratory system is like a factory assembly line. Your heart is the engine that makes the assembly line move. The blood cells with hemoglobin are boxes. Oxygen is the product that goes into those boxes. So your heart and circulatory system keep the production line full of boxes moving right along. But sometimes the boxes aren't getting filled up properly because you might have problems getting oxygen in because of lung issues. If this is the case, then the saturation levels are low. Sometimes the boxes are full, so your saturation levels are where they should be, but for some reason the engine, or heart, isn't moving the boxes through properly. This could be because of a heart condition such as congestive heart failure. Sometimes there is plenty of product or oxygen, but not enough boxes, and this means that you're anemic. Anemia means that you're low on red blood cells. Studies have shown that anemia is common with those who have COPD or other inflammatory-related conditions. Basically, a pulse oximeter can tell you how full your boxes are, but it won't tell you how many boxes you have, or if they're moving along normally. And this is why readings aren't always a good indicator of breathlessness and why you shouldn't solely depend on pulse ox readings. If you're feeling any symptoms of hypoxia or low oxygen levels, such as confusion, changes in heart rate, coughing, sweating, wheezing, shortness of breath, or a blue tint to your lips or fingertips, you should seek immediate medical attention.